So Dr. Deber, by now, everybody knows you. Let's just jump right into it. What can you share for those individuals who know I probably need to get both of my knees replaced, but do I do them at the same time? Do I do them at different times? What are the guidelines?
Sure. So I do get that question as well. About 6% of the knee replacements are done bilateral or same time. I mean, I should clarify, bilateral, it could mean stage, and what that means is you do them one at a time, and there's like some time in between, like a few weeks or months, or even years if people want to push it out that far, or simultaneous, meaning that both knee replacements are done at the same time under the same sort of hospital stay or anesthesia. And so there is a lot of literature about this topic. This is something that continues to be discussed. The most recent up-to-date topic that was published was at the number one journal for orthopedics, the Journal of Bone and Joint Surgery, JBJS. And so they looked at the whole this national healthcare system that basically keeps tabs of all these patients that had same simultaneous bilateral knee replacements, and looked at comorbidities, meaning what kind of medical problems the patients had, how sick they were, what age they were, smoking history, and everything else. And they sort of tiered these patients into one, which is pretty healthy, and four that were very unhealthy. And they looked at those patients in all these different categories when they had same time bilateral knee replacement versus stage. What were the outcomes? And they looked at infection, they looked at bleeding, they looked at blood transfusions and pneumonia, blood clots, pulmonary embolisms, and even mortality. And they saw that there was anywhere from 2 to almost 4 times the increase of those complications. Okay. And so while there's many, I'm sure patients can come and say, well, I saw this paper that looked at those patients. They said there was absolutely no change in the complications. Yes, there's some studies that show that, but this was a very nicely well done study, because they actually tiered the patients, and they didn't have them all grouped together. They actually individually tiered them into 1 to 4 from a morbidity standpoint. And they saw that every single step of the way they do have higher. And it makes sense, right? If you're going to have double the surgery at the same time, of course you're going to lose more blood. Of course you're going to be prone to transfusions. Of course it's going to be longer anesthesia, higher chance of a blood clot. All those things sort of make sense. The benefits, I mean, it's worth saying that. Well, is there ever a benefit to doing both at the same time? So, yes, of course. So there's certainly a cost to the patient, so it's cheaper to them. Cost to the hospital, cheaper to the hospital. Of course, one anesthesia, so the body doesn't have to take 2 anesthesias at the same time. That's the reason why, and this is for another time, while we avoid that altogether, we should do regional blocks. And so, yes, there are some benefits. However, this study, it seems to be pretty well performed studies, show that there's higher complications. So what I tell my patients is that, okay, here's the information for you. This is what you're sort of looking at. You're looking at a higher risk of these things that are happening to you: the blood clots, the infections, the bleeding, the transfusions, pneumonias, all that. However, while you're at a higher risk, it's not extremely high overall. I mean, we're talking small percentages here. We're not saying 40, 50. And so it's important to also talk to them and say, okay, you are at a higher risk, especially since you have more medical conditions. So I think it's safer for you to do this. However, my younger patients who have absolutely no medical problems, take minimal to no medications at all, yes, it's a little bit of a higher risk. However, overall, it's pretty safe to do it. So that I'm selective with my patients who are younger. I mean, I got to tell you, while these numbers mention those things as far as the complications, what I really worry about is the physical therapy, right? And you go through this great operation, and it's just so much pain for them. They can't handle it. They can't do the physical therapy. They can get their motion that they're supposed to get. And that's really where I think that's the higher chance of happening, which is it's not the same category as getting a blood clot or getting an infection, stiffness. But to me and to the patient, stiffness is just as bad. I mean, talk about going through the surgery and taking on the risks with a horrible outcome, less than ideal outcome, and now you're dealing with a knee that doesn't function as well. So to them, this is a big deal. So I just mentioned that as well, and say, hey, look, functionally speaking, you're going to be at a higher risk of stiffness. You're going to be at a higher risk of not doing as well as somebody who sort of takes their time, focuses on one knee, deals with one painful knee, going through surgery instead of both at the same time. And so that's kind of how I tailor my discussion. and somebody who's young, great social support, very motivated, in great shape. There's no deconditioning or frailty heading into the surgery. I say those are great candidates. So I'm still a surgeon who provides that for my patients, but I'm sort of what the national average is, which is 5% of the time. And this is what and that's what I also tell my folks. I say, you'd be surprised that maybe getting one knee done, you offload that other knee so much so that you may never really need it. All that other knee needed was just a well-functioning sort of straight knee, and you can pretty much get 5 to 10 years or maybe forever. That knee just never really needed anything. It felt great, and you can live the rest of your life with just having had one operation. So you just never know, and I'm always there for them to have it done if they needed it. So it's not like it's you can only get one chance of going this through. We can always come back, do the other side if we need to.